Welcome to the Health and Wellness Show. This is Paul Hamilton. Today we're going to be talking about pain, stress, and sleeping disorders. We're going to do this from the perspective of a hypnotherapist. Today we have Vinnette Mohan with us. Welcome to the show.
Thank you, Paul.
I'm glad you could make it today.
It's a pleasure.
I'm quite interested in getting into the subject matter I just mentioned, but before we begin, I was just wondering if you'd tell me a little bit about your area of expertise.
Okay. So we are master hypnotists, and what we do is we're working with hypnosis to assist clients in changing habits and behaviors. And we work primarily with stress reduction, pain management, panic disorders, fears, phobias, anxiety. We also work with things such as weight loss, smoking cessation, and other areas of general self-improvement, such as self-esteem and self-confidence. So as long as it's something to do with the thinking, the way you're thinking, we can always help. But I know that's not where you're focusing today.
That's fine. So it's quite a broad range that you
Yes.
that you
Hypnosis
treat.
is extremely successful in many areas, yes.
So how did you get started in your field?
Well, I suppose I should say, Paul, that I have always had a natural interest in helping people. And I was always fascinated about the mind and how it works and the power of positive thinking and mindfulness. And I became more interested in hypnosis about 15 years ago. And that interest led me to Positive Changes, which is a network of hypnosis clinics in Canada and the United States. And I have been practicing hypnosis since, and here I am.
Terrific. Now, I imagine there's a fair bit of education and training that you have to go through to get to the point where you're at now.
Yes, I suppose you could say that. We at Positive Changes, we have our own training centers in the States, and we've been practicing hypnosis since, well, Positive Changes have been practicing hypnosis since 1987. So they have their own comprehensive hypnotist training program, which all owners and staff are required to take and to work in order to operate Positive Changes centers. So additionally, like in any other health and holistic type practice, we are continually attending ongoing seminars, workshops, and to keep abreast and keep up to date to provide the most comprehensive care for our clients. So having all of this training and years of experience, we are now considered master hypnotists.
Terrific.
Yeah.
So I was wondering if you could tell us a little bit more detail about what type of services you provide then in your clinic.
Okay. So as previously stated earlier on, Paul, we provide hypnosis services for clients wishing to make lifestyle changes or to alter habits and behaviors to promote positive mental and physical health and well-being. We also teach our clients self-hypnosis techniques to help support clients to continue the positive changes we have helped them to make here. So these changes are ongoing because they're practicing at home and they've now got the tools to do so.
Mm-hmm. So if a patient came into you with stress, what do you see in patients who have stress?
So sorry, could you repeat that question, Paul?
What do you see in patients who have stress?
Well, it seems that, most people have some form of stress in their in these modern day living. So we see clients pretty much every day with stress levels so high that they are feeling overwhelmed, so that they reach the point where they begin experiencing anxiety and panic attacks and are having difficulty coping with everyday life. So in this instance, hypnosis is extremely successful in releasing the anxiety and the panic attacks and the stress, and through teaching them again hypnosis techniques, we find that hypnosis is a very profound form of relaxation, and if you're relaxed, you're unlikely to be feeling stress. So, we find it to be extremely helpful for our clients.
Terrific. And what do you see in patients then who have pain?
Well, we deal primarily with patients that are suffering from chronic pain disorders such as headaches, migraines, backaches, joint pains, and phantom pain. So again, hypnosis is extremely helpful in modifying the perception of the pain and to manage the pain, working in conjunction with whatever their health care professionals might be doing for them. So again, this is where We're not looking to mask or cover up the pain or the problem, but rather to help them to manage it better. And that's why, again, we'll teach them a lot of breathing exercises. We'll make CDs for them to listen to at home, and we'll teach them self-hypnosis techniques that they can apply so that they're able to manage independently without us once we've finished working with them.
So you're giving them the tools, providing them with the tools to
help
continue
them,
on.
yes, not just for the time they're here with us, but for long-term success, for them to continue to be to manage the pain better.
So we've talked a little bit about stress and a little bit about pain. How do you explain the connection, perhaps, between stress and pain?
Well, it is pretty much accepted that stress lowers a person's threshold for pain. And in turn, the pain increases the level in the individual, almost like a vicious cycle. So we find that, they are both connected in that way, because it's hard to feel calm when you're suffering from aches and pains. And so I suppose in a way they are very, very much connected.
What type of stresses might you see causing pain then, as an example?
Probably the most common stresses causing pain, I would say, Paul, would be everyday domestic, family, or work-related situations that individuals have difficulty coping with, and that be leading to physical discomforts and pains such as tension headaches. Migraines are very, very popular or common ones, shoulder and neck, back, myalgia pains, stomach cramps, irritable bowel syndromes. That's just to mention a few, but those would probably be the most common ones that we see.
So you mentioned quite a number of types of pain there. If somebody has some chronic pain that's been with them for a long time,
Mm-hmm.
what type of effect does that have on them psychologically?
Well, we find when an individual is suffering from chronic pain, they usually are very uncomfortable and are usually unhappy. They can also become very stressed and anxious or depressed or withdrawn, and often are unable to function normally. So again, this is where we would do some hypnosis for them to help them to feel more positive, to begin to maybe get involved in activities that might help them to distract themselves away from the discomforts that they're having. So it's not just the work we do is not just dealing with the problem, but helping them to develop coping skills, as I said before.
Okay. Now, how does not sleeping well, because a lot of people don't sleep well, and sometimes it's also related to pain, but it may not be, but how does not sleeping well affect patients psychologically?
Yeah, like that's a big question, because we know that chronic pains do often lead to insomnia, and when we're sleep deprived, the pain is then magnified and unbearable, which leads to irritability, moodiness, and generally a very unhappy person. But again, this is where hypnosis is extremely helpful, and I talked before, Paul, about making CDs for our clients, and especially in situations like this where a client's not sleeping well, what we would do is we would make a CD that would help them to sleep better, so that often when people are having these sleeping disorders, they either have difficulty going to sleep or they wake up frequently. So the CD would be a lot of positive suggestions, a lot of relaxation to help them, so that they can hopefully get back into some sort of a normal routine by practicing using their CD on their own, which is another form of self-hypnosis. Mm-hmm. And we find that to be extremely helpful as well.
So are these standard CDs that you have in your practice, or are they customized for each patient?
We do, because Positive Changes is a chain of hypnosis centers. Yes, we do have ready-made CDs, but those are not the ones that I'm referring to. These CDs that we're talking about are created live here. We have very sophisticated recording equipment, so we're creating those here for them in a live session. So it speaks to the client, because everyone has different problems. These are all broad things that we're talking about, but they'll affect each individual differently. And because our lifestyle and our situations are so unique, A generic CD may not speak to that client or help them the way something that is made for them would. So we actually, once we're doing the sessions for the clients, we actually make a CD for them that would sort of be like a condensed version of their session to take home.
So it's speaking right to them and their issues.
Specifically to them, exactly, their problems and their area of wherever they're having difficulty. So we find that clients return time and again and say how very successful that was for them.
And the message is very congruent with their situation.
Yeah.
So what are some of the tips that you might have for somebody who's looking to understand a little bit more about stress and pain and the psychological effects from your point of view?
Yeah, I think the first step, Paul, I think in understanding stress and pain is that they are both manageable. Often people are so frustrated and feeling down when they're suffering from stress and pain that they think that there's no end to it. But we do believe it's manageable, and it is possible to modify the brain response to both. So we usually, say to them, think positive, because that is very helpful in having a positive attitude. And practicing deep breathing and meditation and self-hypnosis, people sometimes don't see the value or understand the value of deep breathing and meditation and self-hypnosis, but it's wonderful medicine for the mind, body, and spirit. And to make lifestyle changes such as eating healthy and exercising, which everyone tells everybody, even if it's moderate exercise, will often help a person suffering with those conditions. At least we found that in the clients that we've worked with. And again, when we're making CDs for them, this is where we can implement suggestions to help them to have that positive thought, to remember to breathe and to try to relax themselves, and to eat healthy and exercise, and just generally taking better care of oneself.
And again, your practice, since its inception, it's been around, you said, since I think 1987, and you've been dealing with pain and stress and sleeping disorders. So these are, proven techniques and approaches that have been used over the years to help people.
100%, Paul. Yes, 100%, yes. Yeah,
so
we've had a lot of experience and a lot of good results with what we've been doing.
So if listeners wanted to get in contact with you, what's the best way that they can do that?
Well, there's always the online thing, positivechangestoronto.com, or they can email us, and they can also give us a call at 416-488-4724. We're always here.
Okay, and what was your email address then?
So it's toronto@positivechanges.com.
Terrific. Vinnette, I'd like to thank you very much for being on the show today. We appreciate your time and your expertise.
It was truly a pleasure, Paul. Thank you for having me.
My pleasure. Bye-bye.
Bye for now.